Dr. Jason Saunders here with HBOT USA doing another research review. So today we're going to talk about vascular dementia. So in particular, I have a meta-analysis. So we like meta-analysis because they're basically going back into the old research. They're looking at multiple studies over long periods of time. And so in this particular one, we have a meta-analysis for vascular dementia. They went through 8 different databases to collect the data. They have 25 randomized controlled clinical trials, and it involved almost 2,000 patients, so 1,954 patients. Throughout the course, there was basically a medication group, a hyperbaric group, and then a combination medication hyperbaric group. Across the board, there were improvements seen in the hyperbaric group, both in the hyperbaric only group as well as the hyperbaric and medication group above what the medication group was by itself. They saw what says strikingly improved mini-mental state examinations and massive improvements in activities of daily living. And so here's the thing, 2,000 patients, they went through similar treatments, obviously improvements in their cognition as well as their ability to do activities of daily living. And so, well, we have to understand the mechanism here. And so especially with vascular dementia, hyperbaric will help with most types of dementia, but with vascular dementia specifically, we're talking about basically a decrease in blood flow to the brain. And if we're going to decrease blood flow, that also means we're going to decrease oxygenation to the brain. The brain is about 2% of our body mass, and it uses somewhere between 20 and 25% of all of our oxygen. So it's a massive metabolic machine. It's using extraordinarily high amounts of glucose or ketones, depending on your diet, and a huge amount of oxygen in order to perform its normal function. As we get a breakdown in the circulation of the brain, we're going to lose oxygenation. Ultimately, it means we're going to lose power, we're going to lose function. And so hyperbaric oxygen, 1, delivers increased oxygenation levels right away. 2, also helps to support neovascularization. There's an enormous increase in new blood vessel growth as well as old blood vessel healing that occurs after long-term hyperbaric treatment, anywhere from 20 hours or more. And so with increased oxygen, healing of old blood vessels, and then the creation of new blood vessels, not only are we going to increase the oxygen in the short term, thereby improving function, but we're also going to help heal the initial insult in the first place, which was the damaged blood vessels. And so not only will there be a short-term relief, but there's actually going to be a long-term healing because we're going to be improving circulation for the future. So absolutely, hyperbaric oxygen is very useful for vascular dementia.